Hello. So I think we're going to get started. Can you guys hear me? Can everybody hear me okay? Okay. So my name is Kelly Kaiser, and I'm with Intercommunity Health Network Coordinated Care Organization, the local Oregon Health Plan here in Lincoln County. And I wanted to thank you all for coming this evening. We have a good agenda to give some updates on what we're working on and some of the areas of focus, and then also have an opportunity for questions and answers as we move forward. Under the sage advice of Commissioner Bill Hall, we're going to see how much we can get through in the next hour, recognizing that some people might want to take Highway 20 back to the valley if needed, and it closes at 7, and so we would need to leave here at 6:30, and if people need to leave at 6:30, that's of course absolutely okay. But we'll continue to keep our program moving so that we have that option for those who need it as it comes up. I first wanted to let you know that we do have translation services here, and Omar is, there he is, over here sitting over with Cheryl Connell if you need translation services, and he will be able to assist with that. And we do have our child care upstairs if there is any need of that. And would also just like to ask if you have a chance to fill out the survey that's on the table. We really want to make sure we get the feedback on how these meetings are going and are we meeting the needs of the community in terms of answering the questions that are out there. So if you could do that, that would be great. So I'm actually going to turn it over to Dr. Ewan Chinna, who's going to start by setting the stage for some of the information we're going to share today in terms of some of our focus and our pilots.
Good evening, and it's great to be back in Lincoln County and specifically Newport. I had a chance to get to Nye Beach just for a few minutes before I drove over here, and for that moment in time, the clouds actually broke for a moment, and I saw sunshine, and I feel exhilarated because I always need to see the coast to get my mind back in a holistic point of view. So our Delivery Systems Transformation Committee is a group of individuals, very hardworking individuals, that meet every 2 weeks, and we've been meeting for the last few years. And this group helps deliver funding for specific pilots to transform the healthcare delivery system. Kim Whitley, our Chief Operating Officer of Intercommunity Health Network, is the chair of that Delivery Systems Transformation Committee. And what you're going to hear next is from a group of two individuals that are looking at changing the way that we address pain in our communities. And this approach was specifically funded by the Delivery Systems Transformation funding through IHN, through Intercommunity Health Network. So I'm very proud to introduce two individuals. Kevin Cuccaro is a board-certified anesthesiologist that specializes in pain management, and Nalita Onslow is a nurse practitioner right here in Newport. And the two of them are going to take us on a journey of how we can all view approaches to pain management differently than the historical approach that we've done. So, Kevin and Nalita.